They're going to take it off the market and put it back. What's the deal on that whole?
Celebrex is currently still available. Vioxx was taken off about 7 or 8 years ago.
Okay.
But yeah, Celebrex is still available. Celebrex is almost where it's going to be generic. We still have some problems getting some of the insurances to cover it. But again, it's a medication you can take chronically and it won't have the GI side effects of the other medications.
And that, that brings up the knee braces and injections, things like that. Like I said, I went through just about all of those types of situations. In order for you to understand it, let's go back to Oceanside, California. I played athletics for 30 years. I started with Little League, went to Pop Warner football, high school football, baseball, basketball, ran track, and did the whole gamut of things. So my body has had 30 years of athletics, constant pounding of athletics. And I took it to a level that being a professional football player, that you have to be consistently in shape to do the things that you did. Okay, and I can remember the times that they did cortisone injections. And even when I was back in Green Bay when it first started, the cortisone injections, I would not let them do it in the same spot and more than one time. Because, in athletics, and especially professional football, they want to put you back on the football field as quickly as possible. And sometimes doctors will go through things and do things that they normally wouldn't do in the football arena that a normal doctor would tell you no, no, and no. But that was professional football. So one of the things that I had to do after 3 years ago, I decided that I needed to get my knees done. Okay, it was time. I was bone on bone, just like some of those slides. I've been through the braces. I have a good friend, Greg Nelson, who started Donjoy, the knee brace company. So I've had the personalized knee braces. I've had everything that you can probably imagine. So I figured it was time to get my knees done. When I turned 50, it seemed like my body just went, after all those athletics, it just went down. And so I started thinking about having the knees, and everybody was saying, let's put it off, put it off, put it off. But when I turned 60, I said, this is it. I got to get this done. I'm taking pain pills. I don't want to do that. So I had to take and go in for surgery. So I went to Tri-City Medical Center and had my knees done. Dr. Helgeimer was my physician. And one of the things that I loved about that whole situation was that I went through a situation where I knew what I wanted to do. Now, they said, well, you can't do 2 knees at one time. They didn't want me to do that. Well, they tell you they didn't want you to do it. But I told the doctor, I said, I am not coming back for another surgery. If I go down, I'm going down one time. I want to get the therapy, I'll get it done. So I did both of them at the same time. I stayed at the hospital actually for 4 days. 4 days in the hospital, and they do what they tell you to. They get you up right after surgery. As soon as they woke me up, I was walking. I started having walkers, so I was in a walker. And my whole goal was that I had to, and I play golf. This was another reason I wanted to have the surgery done. I wanted to be able to start swinging the club, but I had to go back to Wisconsin where I put on a golf tournament. And Dr. Helgeimer said, if you are on a walker, you cannot fly. So this was going to happen in 6 weeks. 6 weeks. So I had a goal for myself. So I decided I was going to get ready because I wanted to go back to this golf tournament. So I was able to make that achievement. But I spent 4 days in the hospital, but I spent the most important 6 days in the Tri-City Medical Center's training, physical therapy. That's what really did it for me, that constant physical therapy. Because you have to know, I wanted to get my body back as quickly as I can. The range of motion that you need to get back in your knees, you have to get it back quick. And I was there, they pushed me, they did all the things, and I said, you're being too light on me. I said, I know I'm going to feel pain. I want to feel pain, but I need you to push me to the point where I can get back to where I need to get to. So they pushed me hard enough that I got out of there. I was able to do the things that I wanted to do, like go play some more golf. They told me I could swing a golf club, no drivers or anything, just wedges and stuff. But I was able to do that. My first physical therapy activity was Wii tennis. And the medical center had pulled it right out of the box. This is the first thing. They had never used it before. But they said, well, do we know that we can start turning Wii tennis? I said, okay. I never played tennis before. Still can't play tennis, so it doesn't matter. But those are the things that helped me out in my therapy and the things that I needed to do. So you have to make a decision for yourself as to when your body is ready to do those things. And when you decide to go in or not to go in, or how long to put it off. You have to make those decisions yourself. But the mindset, like they said, of every individual is different. You have to mind or will yourself to do the things that you really need to do to get your body back in the shape that it needs to be in. And that's what I try to do. And that's what I learned in sports. You know, one of the best things about sports, besides being, I mean, it was a team sport, and I love playing team sports. I was actually a better baseball player than I was a football player. And I was drafted by the San Diego Padres my freshman year of college. And I decided that I didn't want to play baseball. I wanted to play football. I wanted to get an education. So I continued this whole turmoil of training myself to be a professional football player. Because I kind of knew and had an idea what I wanted to do with my life. I wanted to play professional football. So I finally made it. I went from Miracosta College, San Diego State. And at San Diego State, I became an All-American. Got drafted in the first round by the Green Bay Packers. I was the 7th player picked in the first round. They called me up and said, hey, Willie, do you have a big coach? You've been drafted by the Green Bay Packers? I said, no, but the money you're going to pay me, I can afford to get me out. So I went back to Green Bay, played there for 7 years. There was this coach that I had at San Diego State by the name of Don Coryell. Now, Don Coryell was the most innovative coach in the world. I don't understand why he isn't in the Hall of Fame, but that's another story too. But when I came out to San Diego in 1978, I was playing for the Green Bay Packers, and we were playing the Chargers. I was playing my option out because I had that 7-year itch. After 7 years in Green Bay, I was thinking I needed to make a move. I really wanted to stay in Green Bay, but I needed to do something different. Put them on alert that I needed to be paid to play this game a little more, and that's what we do in football. So I came to San Diego in 1978, and I remember this game so vividly. September the 24th, 1978, 104 degrees on the football field, Jack Murphy Stadium. Green Bay Packers versus San Diego Chargers. I tied an NFL record of 4 interceptions in one game. 4. When I called my parents in Oceanside and told them that, tell me how many tickets we're going to need for this game. It started out by immediate family. By the time we had finished, it was over 300 tickets being purchased. All of Oceanside was there. So with that in mind, I got the 4 interceptions. The next day, they fired Tommy Prothro, the head coach, and hired Don Coryell. So I figured we're 4 or 5 games into the season, so I could start petitioning to get me back to San Diego, where I started. So I was able to get traded back to San Diego, played with some great athletes, Dan Faust, Charlie Joyner, Kellen Winslow, Chuck Muncie, and all of those types of guys. Had great teams, enjoyed it. So that was great to get back here. But then we talk about our physical health of the things that are happening now. Now, I've lost 3 teammates on my 1979 football team that were younger than I am. So what we're doing here is trying to educate you as to going to the doctors and taking the test. Men, especially men. You know how proud we are. Men, do the test. It's just basic and simple. And we got to do those types of things because we lost Junior Seau, great man, okay? And now we just lost Tony Gwynn, great man, but they're too young for these. And a lot of those things were caused by them not really going to the doctors or being on the right medication or anything like that. So we have to look at the things that we do in our lives. Our bodies are magnificent machines. God made a great machine out of it. But you have to understand, you have to put the right things in your body to make it run. And then you have to service your body the right way to keep it going. So with those things in mind, you have to understand. If you need help, you need to go get help. If you're in pain, figure out what you can do to relieve the pain through a doctor and get it done. Get it done. It's just as plain and simple as that. So this whole clinic was set up for that. It was a symposium. This is the second year they've done this. And really to enlighten you as to, all the different types of testings that's available for you. So with that in mind, just keep it in the forefront of your thought and your mindset to go out and do these things. Tell your people, your friends that you know of. I mean, I have some friends that I really, really, really keep telling them, go to the doctor. I had a good friend named John Brockington. He played for the Green Bay Packers. He was Rookie of the Year in 1971, and I came in to Green Bay the next year and was Rookie of the Year in 1972. So the Green Bay Packers had 2 back-to-back Rookie of the Years. Now, John Brockington was from Ohio State. Anybody a Buckeye fan in here? No Buckeye fans, that's good. John Brockington had almost kidney failure because of he never went to the doctor to take a physical. And he almost died. So he had gotten a kidney transplant, and the lady that gave him the kidney transplant was a good friend of his, who is now his wife. So, and she was a short little thing, and they didn't think she had an oversized kidney, but she did. And she was a match for him, and so she gave him her kidney. John gave her his heart. And they got married. So that was a true a story that I just find touching. But I just saw John the other day. I wanted him to come up and speak to you guys today, but he had to go out of town. But again, it's all about the testing and getting the physical and getting to see your doctors and believe in the things that they're doing for you that can help you. And it's going to help you. It's going to help you. So I thank Tri-City Medical Center for giving me an opportunity to host this event. And what we're going to do now is we have a few more raffle items that we want to give out. And I'm going to actually hold it to about 5 minutes of questioning. If you want to come ask me for questions, I got 5 minutes. First question.
I just want to ask, for the younger football players coming through, do you think they made enough, the NFL made enough protection to the knees, concussion? It's now a big issue.
Concussion is a big issue. I think they're doing everything that they can to prevent these types of things. But football is a violent sport. Basically, it's a violent sport. But you can see over the years what they are doing to engineer the new types of helmets and things like that. But football is a violent sport. Okay? And right now, what they're doing right now is really hurting the players, especially defensive players, who can't react like they want to because they're afraid to hit somebody in the wrong place and get fined. Because so it's hurting at the same time. So, question? Yes, sir.
Do you think San Diego will keep the Chargers?
I think the San Diego will keep the Chargers. They better. Question?
What do you think San Diego Chargers need to be a champion?
I think they got it. They got a good draft coming up, and so some of the things that they're doing, and you say that every year. We say that every year. I say that about every team, and every person that has a team of choice will say that. But this team is a better team than it was last year, right now. I've been down to practice. What I do is I do uniform code enforcement for the league, for the NFL. And what that means is I go out on the football field every home game and monitor the field. Ask the players to tuck in your shirts, pull up your socks, let's get some protection. Take your knee pads and put them below your knee for protection, and they don't listen to me. And when they don't listen to me, I write a little note to the NFL and I fine them $5,000 per infraction. Per infraction. I remember the Super Bowl, I did a Super Bowl and we had one out in San Diego, and I fined one Oakland Raider player, I love that too, $125,000 in fines. That wasn't a Lester Hicks. Okay, question.
You had your knee replacement. Did you have any replacements?
I had total knee replacement.
Okay. Did it affect your musculature from your hip down, or just the localized area of the knee?
The whole parts of my body, as long as, I mean, because I didn't work out as hard as I should have worked out, but I knew I had to get in some type of shape to get this operation done. So I know that I'm not in the shape that I should be in, but you have to continue to work out and do the things. Exercise and diet are two of the things that every doctor has talked about today, okay? You're exercising and your diet. So change your diet. In September, I decided to go on a juice diet, me and my wife, so which is helping me get the things that, and the doctor talked about all the fiber that you get back in your body. I'm starting to get those types of things. So just by eating the right things, okay, putting the right things in your body is a magnificent machine. Last question.
Knowing what you know now, like a year ago, going back in your career, what would you have done differently preparing for football, baseball, running? I mean,
There really wasn't anything you could prepare for. I told one thing. I got knocked off my feet one time by a lineman, and I said to myself, and it was in a college all-star game, and I said, I will never, ever let anybody get to my knees like that. So I protected myself as far as my knees. Now, if I was laying on a pile and somebody piled on me, that'd been a different story. But I made sure that no one got to my knees when I was playing football. So that was the mindset that I had. So I don't know what other players thought, but it helped me to play 11 years in the NFL. And I could have played 15, 20 years if I had wanted to. But I told myself when the game ceased to be fun, because that's what I liked about it. I was going to retire, and I did. So, okay, we're going to move along and get this wrapped. We have 1, 2, 3, 4, 5 items.